It may sound absurd to someone who's just very much aligned with the mainstream that the healthcare industry is actually one of the main vehicles of abuse in the world. They might just think that's a ridiculous idea, but it's actually true, and it's um, especially true in the area of psychiatry. There is a massive amount of abuse that has occurred with psychiatry and continues to occur, mainly with the use of antipsychotic drugs, various kinds of pharmaceuticals that are supposed to, you know, cure so-called mental illness, but in fact, these drugs are extremely dangerous and oftentimes make the experience of the patient even worse and lead to their death, which would have not happened otherwise. There's countless documented cases of, young people being prescribed psychiatric medication and it actually leading them to suicide or violent behavior. And this is all, for the most part, written off because the medical industry is just seen as like this holy industry that, anything that appears to be a mistake is just must just be minor, and overall they must be doing so much good, and we should just basically give them the power to prescribe whatever it is they want to prescribe, and diagnose people with whatever you know so-called disorder they want to diagnose them with, and um, even go as far as basically torturing patients with things like electroshock therapy and restraining them in their beds and gagging them, and just really awful, hellish experiences people are going through, all in the name of safety, of course, right? It's always like with so much abuse in the world, carried out in the name of safety, right? Oh, they're a danger to themselves and others, so we need to abuse them in this way. And the government fully supports it, and there's all these, you know, mock trials, you could call them, where the patient is already drugged and they're brought into to court and then deemed to have, whatever mental illness because they're not able to defend themselves coherently, but that's because they've been drugged already. So it's just this cruel joke of, you know, justice being carried out. But the other thing, or the main thing with psychiatry that's especially evil, is that they've been given the power by the state to basically just label whoever they want with whatever disorder they make up, or whatever, in their ever expanding book of so-called disorders that they cook up. Each disorder, of course, corresponding to some pharmaceutical. And so they've basically been given the power to deem someone, as being mentally ill, and then that's supposed to justify violating their human rights. They basically can just become the slave of whoever is administering the psychiatric treatment. Whoever is doing that can drug them any way they want. They can restrain them any way they want. They can restrict their access to family members, or, basically do whatever they want to them. Electroshock therapy. They basically just become a guinea pig of whoever the so called doctor is. you know, pushing this so-called medicine, the so-called psychiatry treatment. There's an organization called the Citizens Commission on Human Rights, and they have a few documentaries. One of them is named Psychiatry in Industry of Death. Highly recommend you watch that along with their other documentaries. I'll link to that below, and I'll just tell you the link right now in case you don't see the link. It is cchr.org/documentaries. Again, that's cchr.org/documentaries. Also, there's a article that I highly recommend you read, and that article is titled "Why Psychiatry is Evil" by Wayne Ramsay, Ramsay. It's a very good article, and at the end of the article, it also gives a lot of book recommendations on people talking about the evils of the psychiatric industry. So, previously I was talking about why medical mandates in the form of masks and vaccines are evil, why they're abusive. But the psychiatric industry has been, pushing medical mandates of their own for years prior to this whole so-called pandemic, that started in 2020. They've been mandating people take certain drugs and, undergo certain treatments that have been very destructive and have caused immense suffering to millions of people, and untold numbers of people are suffering right now under so-called, the so-called care of psychiatric centers and hospitals and whatnot, whatever they're called, whatever the building where the torture is being carried out, whatever official names and titles and nice sounding vocabulary they use, it doesn't really cover up once you look into it. It's a thin veneer on the surface, but beneath the surface is massive amounts of abuse. And it oftentimes happens that once someone enters the care, once you just step into the door of a hospital, you can easily lose your freedom and life, under their care. They just then claim the right to control your body and mandate whatever they want, always in the name of safety, always in the name of health, and, this preemptive attack that just so happens to profit them, right? They get they call it kickbacks, for all the drugs that they administer to patients, right? The pharmaceutical industries will pass the profits along to those hospitals and doctors and whoever. And you can find information about that as well. I believe that article I just mentioned, Why Psychiatry is Evil, mentions that. So it's just, a lot of corruption and just abuse taking place, and the state, fully supports it and just gives them this blank check to take over people's lives. And it's just terrible to try and even imagine the suffering that a lot of these people are going through. You can't even imagine it because they're just because you can't see it. A lot of it is like a hellish experience brought on by the drugs, and you can't even understand or know what they're experiencing, and they further, the torture and isolation. They further the torture through isolation, and if people don't have family members present, um, friends and family to basically intervene and rescue their family member or friend from the hospital or the center, it'll probably just get worse and worse. They just get drugged more and more, and could be going through more harmful and painful treatments like electroshock therapy and so on. And there's no one there to help them. And abuses by psychiatrists, this is not like, again, just some wild conspiracy theory. Like, this is extremely well documented in several documentaries, by that one organization alone that I mentioned. But like I said, there's many books and articles that have been written, many testimonies about the harms of the psychiatry industry. So it really goes hand in hand with the medical mandates that they're trying to push on everybody, in the name of fighting a virus, right? So whether it's a virus or so-called virus or so-called mental disorder, they are trying to abusively control others through preemptive attack, through medical mandates, and it's 100% wrong. It should not be accepted that they can drug people and, administer medical treatment on people against their will, or coerce them to accept certain treatment, by saying, well, if you don't, you're going to lose your job, or you can't travel, etc. There should be zero coercion to take any kind of drug or medical treatment or use of medical device. That's just completely wrong. The end. And it just shows how lost humanity is, how lost society is in an ethical sense, in an ethical context, that they even entertain this at all, that they think, oh, well, we need to do what's necessary to, protect the greater good, and they don't recognize that abuse is just evil every time, all the time, in every conceivable scenario. And medical mandates are a form of abuse, and so therefore they're always wrong. It's really that simple. If you don't see it that way, you just, like I said in the last talk, you're just mistaken. Like, your thinking and your ethics are flawed. So I hope, if you were thinking that way, hearing this perspective and looking into these resources will wake you up and end your support for abuse through the medical industry. All right, thanks for listening.